Health alert. 8 silent signs of cancer. You should never ignore cancer as a disease that often develops without obvious symptoms in its early stages, but the body may send subtle signals that, if recognized in time, can make all the difference in treatment. In this article, we'll explore 8 silent signs that may indicate the presence of cancer and explain why you should never ignore them. Additionally, we'll discuss when to see a doctor and which tests can help with early diagnosis. 1. Unexplained weight loss without diet or exercise. What it could be: pancreatic, stomach, esophageal, lung cancer, or lymphoma. Why it happens: tumors can speed up metabolism or interfere with nutrient absorption. When to worry: if you lose 5% or more of your body weight in less than 6 months without an apparent reason. 2. Extreme fatigue that doesn't improve with rest. What it could be: leukemia, colorectal cancer, or tumors causing blood loss, anemia. Why it happens: cancer consumes the body's energy and may reduce red blood cells. When to worry: if fatigue is constant, even after adequate sleep, and is accompanied by paleness or shortness of breath. 3. Persistent pain without an obvious cause. What it could be: back pain, pancreas or ovarian cancer, unrelenting headache, possible brain tumor, rare but possible, bone pain, multiple myeloma or metastases. When to worry: if pain doesn't improve with common painkillers and lasts more than 4 weeks. 4. Skin changes, new spots, changing moles, jaundice. What it could be: melanoma, skin cancer, asymmetrical moles, irregular borders, or color changes. Jaundice, yellow skin, eyes, pancreatic or liver cancer. ABCDE rule for moles: asymmetry, border irregularity, color variation, diameter greater than 6 millimeters, evolution changes over time, unusual bleeding. Where and what it could be: coughing up blood, lung cancer, blood in stool or urine, colon, rectal, or bladder cancer, vaginal bleeding outside menstruation, uterine or cervical cancer. When to worry: any unexplained bleeding should be investigated. 6. Changes in bowel or urinary habits. Possible signs: prolonged diarrhea or constipation, pencil-thin stools, colorectal cancer, frequent urination or difficulty, prostate or bladder cancer. When to worry: if symptoms last more than 3 weeks. 7. Lumps or swelling in body parts. Where to check: breasts, armpits, neck, groin, and testicles. When to worry: if the lump is hard, painless, and doesn't go away within a few weeks. 8. Difficulty swallowing or chronic indigestion. What it could be: esophageal or stomach cancer. When to worry: if the feeling of food stuck or persistent heartburn lasts more than 3 weeks. What to do: if you notice any of these signs, don't panic. Many symptoms have benign causes. Monitor for 2 to 3 weeks. If they persist, see a doctor. Get preventive screenings based on your age and family history. Mammogram starting at 40 to 50 years. Colonoscopy starting at 45 to 50 years. PSA test for men at risk of prostate cancer. Prevention makes a difference. Maintain a healthy diet. Avoid smoking and excessive alcohol. Exercise regularly. Use sunscreen daily.